Hello, this is Dr. Gay from First Leg MRI. And this is a 40-year-old male who injured himself working out, felt a tear, and has had bad pain in his left groin area. He thought he may have a hernia defect, and he has a hernia, but it's not the typical hernia. He has what we call a sports hernia rather than a bowel-containing hernia, and they can have very similar symptoms. And so this is a coronal T2 weighted sequence. We can see over here the pubic bones coming together. Here's the right pubic bone, left pubic bone, symphysis pubis. We see the adductor muscles coming up here. And on this view right there, we see this abnormal triangular fluid collection. So this is the adductor longus tendon is here, and this is the periosteal attachment right there. And so it is stripped and elevated from the bony attachment, and there's this fluid collection underlying it. So here's the right adductor, and there's the left that's peeled off. And so if we go to the axial images, we'll see the same thing. We call this, again, a sports hernia because it seems or feels like a hernia clinically, or can be confused with a hernia clinically, left groin pain. And here it is right here. So this is the common aponeurosis of the left rectus abdominis. Here's the rectus abdominis muscle. It's got big muscle here, the bodybuilder, and it comes down. Here's the aponeurosis is flattening out, and then it blends right in here to the adductor longus. So the muscle is partially torn here too. You can see the asymmetry and attenuated. There's a musculotendinous junction. If we follow this up again, there's that adductor longus tendon. Should sit right down here. You can see the continuity between it and the rectus abdominis. This is again the common adductor longus rectus abdominis aponeurosis. And again, it can be peeled off like this and just elevated, but otherwise intact. Here and underlined by fluid. Most often the times we see it torn just from the adductor longus and pulled down, and the rectus abdominis component is intact. I've never seen a fluid collection like this before, and the few of these I've seen. There's a sagittal view here. You can see the adductor on the left coming up, and then there's a little edema around the musculotendinous junction where it's partially torn. We're going to see the continuity here. There it is. This is the rectus abdominis. There's that aponeurosis. It just continues on down here. You can see it's stripped right off of that pubic bone here on the left-hand side with a little collection of fluid. So, and a straightforward, easy example of a left sports hernia. Thank you very much.